Okay, so pag-uusapan natin today ang isang topic na maaring baguhan para sa ating mga nasa hack teams na. Pero I'm so happy na meron tayong mga classmates ngayon sa HTTP na hindi pa nagbibigay ng HIV, direct HIV care sa kanilang facilities at nagbabalak pa lang because this topic applies very much to non-hack, no? Ito ay usually nile-lecture natin para sa mga ibang mga providers natin na hindi member ng HIV Direct Service Provider Team. Dahil kailangan natin ng tulong, lalo na't papunta tayo sa universal healthcare. So alam nyo naman yung mga ugong-ugong na balita na pag tayo ay mag-transition fully to universal healthcare, ibig sabihin, every facility, especially those at the primary care level, ay nararapat na kayang magbigay ng HIV testing services at least. And this is how we are going to do that, no? And for that to happen, kailangan natin magkaroon ng some form of training, no? Para sa ating mga primary care colleagues, para alam nila ano yung mga basics ng testing, counseling, ano yung mga hinahanap ng DOH, na reporting method, etc. And who knows, baka kayo po ang atasan ng trabahong ito ng inyong CHD, no, ng inyong respective CHDs, no? Dahil kayo po ang nakakaalam. So, okay. So, ang topic natin is provider-initiated counseling, motivational interviewing out natin. Itong maraming controversies before with regards to provider-initiated counseling and testing, especially from the provider side. Kasi nalilimitahan yung pagkakaalam natin on HIV testing na dapat counselor lang ang pwedeng mag-facilitate ng test. Pero ang hindi natin nalalaman na ang mga providers who have some background informal training in medicine are actually up already, no? Kumbaga, the training that they have is enough for them to be able to facilitate an HIV test themselves without needing to go through the rigorous training ng DOH. Itong mga DOH counselors training are actually for lay personnel. Ito yung mga non-medical na tatao sa mga facilities natin na kung saan HIV testing talaga yung service. So ito ay para sa mga voluntary counseling and testing na personnel. So usually mga lay personnel or KP-led facilities ito. Pero kung ikaw ay doktor, nurse, maaari kang mag-encourage ng HIV testing and you can actually facilitate this in your own, in the privacy of your own clinic. Okay? So, paano? Ayan. So, yan ang pag-usapan natin ngayon. Sige, next po. Next slide. I-down mo na lang. Down. Previous po. So, with regards to HIV testing, we will be guided by the 2022 DOH Admin Order 0035. Ito yung pinakabago nating guidelines on testing, no? Siya ay nilabas noong August of last year. So, if you notice, sa kanyang title, nakalagay differentiated, no? So, hot adjective yan sa atin ngayon sa mundo ng HIV. So, differentiated pertains to an approach that means it is client-centered or patient-centered. It reflects the preferences and expectations of people living with HIV and key populations. Habang nire-reduce din ito ang unnecessary burden on the health system. So, if you think about it, win-win siya. Win sa kliyente and win din sa provider. Next page. So, konting summary lang on the highlights, no, sa testing guidelines natin, comparing the old guidelines to the new ones. So, ngayon, yung minimum age of consent for taking the HIV test is now 15 years old. Dati ay 18 years old siya. Ang mga minors below 15 can provide their own consent. 15 and older can provide their own consent. Pag 15 and lower ka, pero considered mature minors ka, you can provide your own consent. Hindi na kailangan ng parental. Paano ka magiging mature minor? Nag-pregnant ka na or nag-engage ka in high-risk behavior. Example, sex work, injecting drug use, yan. So, maaring assistihin ng mga registered social worker or health worker, so doktor, nurse, midwife, ang mga minors na ito. So, maaari sila magbigay ng consent nila na hindi kailangan ng tulong ng parent or guardian pag mature minor. So, ito ay suportado rin ng ating HIV law or ng RA 11166. Ngayon, sa mga hindi naman mature minor, pero gusto nila mag-take ng test, kailangan naman ngayon ng kanilang consent ng parents or legal guardian. Sa mga pagkakataon, either hindi mo mahanap yung guardian or parent with a reasonable amount of effort in 7 working days. Hindi mo mahanap or ayaw nila, pero yung bata gusto, maaaring magbigay ng proxy consent ang isang registered social worker or health worker. Okay? Lalo na kung ang bata ay under DSWD care, is considered abused, neglected, exploited by their family or household, or under special protection ng 7610. So yan, yung mga pagkakataon na yan. Ang consent ngayon ay hindi na lang required na written. Pwede ka makapag-obtain ng electronic or verbal consent kung sa field ginawa yung testing or outside the facility. Pero kung nasa facility, it's best pa rin to get a written informed consent. Okay? Next. So previously sa mga facilities natin, ang nagiging proseso ay HIV counselor will do the pre-test counseling, followed by a blood draw or blood extraction ng isang HIV proficient registered medical technologist. Ang mga reactive screening test or yung first reactive screening test are going to be sent for confirmatory test. So yung pasyente na nag-test positive, sasabihan lang siya verbally na, ang test mo ay maaaring positive, pero kino-confirm pa siya. Hindi kami dati pwede magbigay ng papel noon sa pasyente na reactive ka, pero waiting for confirmatory. Verbal lang lahat, no? Sa bagong guidelines, next. Sa bagong guidelines, marami ng opportunities for testing. Kasama rito ang self-testing, which can be oral or blood-based, pero what's important is FDA-approved yung mga kits natin. Community-based testing, which is led by members of the key population and makes use of the rapid test, and yung usual na facility-based testing na blood draw. So ngayon, sa mga facilities natin na hindi RIVDA, okay, yung mga normal facilities, hindi na kailangan na proficient for HIV yung medtech. So, kumbaga, regular medtech, pwede siya magawa ng HIV test. Sa mga RIVDA, yan, kailangan meron silang HIV proficiency. Okay? Kasi confirmatory labs yung mga RIVDA labs natin. Ngayon, kung ang screening test ng pasyente sa facility ay reactive, maaari tayo magbigay ng resulta upon request. Minsan kasi kailangan ng result ng mga pasyente natin. So, we can actually provide it. If the facility doesn't have a pathologist on board or a way to validate it, the doctor himself can actually sign. Lalo sa mga primary facilities natin na very limited yung staff na doktor lang, case manager lang, tapos phlebotomist lang, ang pwedeng pumirma sa result nun is yung doktor. Okay? Nagawa ko na siya sa mga primary care clinics namin. Ako taga-pirma ng reactive test. Okay, next po, at isang very important change sa treatment guidelines naman natin na related sa ating lecture on testing today is itong principle that will highlight yung linkage to care. Ito yung ART shall be initiated within the same day upon recognition of HIV infection whenever possible. So, na-discuss na to ni Dr. Mark Pasayan dati na barring the 4 instances wherein you need to delay ART, ideally, you need to start it on the same day. So, paano mangyayari to kung ang pasyente natin ay hindi sa facility natin na-diagnose? Paano kung iba yung nag-diagnose nito? So, magandang magkaroon tayo ng network or relationship with the primary providers in our area who do HIV testing so that on the day na mag-diagnose sila, ay sana ay maaaring ma-refer din sa mga treatment centers agad-agad para ma-start ang ART on the same day. Now, in return, yung mga primary care or yung mga non-hacked team members natin dito sa HTTP, sana ay alam ninyo o meron kayong directory ng mga treatment hubs na madaling referan or share the same values as you so that mabilis yung referral process ninyo. Okay, next po. So this is our baseline, kumbaga principles na paghahawakan natin para sa ating topic on PICT or Provider Initiated Counseling and Testing. Okay, next slide. Okay. So ito yung mga iba't ibang models of HIV counseling and testing which you might be familiar with. Meron tayong mga facility-based, very familiar sa atin yung stand-alone VCT. Ito yung mga talagang testing places lang siya na ngayon ay nag-evolve into test and treat places. May mga drop-in centers din tayo na hindi masyadong into testing pero more of treatment centers na sila agad. Okay? So next po. And meron tayong community-based testing, tapos yung couples or partner testing, which actually we calling index testing and SSNT now. Pero yung i-highlight ko is yung previous. Can we go back one slide, please? Is facility-based na testing in clinical settings, such as antenatal care, TB, STI clinics, one-stop shop, and general clinics. Okay? Sige. Next 2 slides, please. Okay, so provider-initiated counseling and testing is very valuable, lalo na sa concentrated epidemic natin dito sa Pilipinas. Kasi it can focus on facilities that can provide services to patients at higher risk for HIV, such as ito mga to. Yung mga kliyente ng mga clinics natin sa mga clinics na ito ay higher risk for HIV, and so empowering them to do testing where they are is going to be a good way to increase our reach. Okay, next slide. So, ang PICT ay HIV testing is that is recommended by healthcare providers in healthcare settings where individuals seek services other than HIV. So, kumbaga, ang problema ko ay meron akong sugat or lesion, no? So, pupunta ako ng derma. So, yung pagpunta ko sa derma, ang reason ko is may lesion ako sa kamay. So, si derma, siya yung mag-fulfill ng PICT role niya. Kasi, although hindi siya direct HIV care, naiisip niya na maaring may link yung reason for consult na to sa HIV. So, iti-test ko na rin siya. Yan ang PICT natin. So, it is an adjunct, a helpful adjunct to other modes of testing. Like any HIV testing, it is neither mandatory nor compulsory, and it will not prevent patients from accessing the original health service. So, yung takot ng mga doktor na, baka hindi na pumunta yung mga pasyente ko rito for derma kasi nagre-recommend ako ng HIV test. Hindi po totoo yun, no? So, in fact, patients have a generally positive attitude about it. Okay, so next. So, gateway siya to services natin, not only treatment, but also prevention. So, meron tayong prevention of mother-to-child services and pagbigay ng PrEP. Next. PICT has known to increase uptake of HIV testing, increase condom use in the clients, and increase enrollment of TB patients in HIV care. Next slide. So locally, it can also help us in the early recognition and treatment of pregnant women with HIV. Next. Because the earlier pregnant women are diagnosed and started on antiretrovirals, the higher likelihood that children will be born negative, no? So, in the future, sana wala tayong ganitong findings na meron tayong mga children born with HIV. So, someday, hopefully, we can have an HIV-free generation. Next. So, provider-initiated counseling and testing also ensures that patients with TB, HIV co-infection will have access to care addressing both their issues at the same time. Hindi yung nauna yung TB treatment, tapos mamaya mo pa malalaman na, meron pala siyang HIV, or vice versa. Next. And of course, PICT will ensure that patients naman who test negative will have access to tools that can help them remain negative, such as PrEP or pre-exposure prophylaxis. Okay, next. So, PICT will help us reach the first 3 bars of the HIV care cascade or yung REACH. So, isipin nyo ang challenge sa atin ng UNAIDS, di ba, is 95, 95, 95. Yung first 95 is 95% of PLHIV will know their status. Etong score natin dito is, I think, 63%. Ibig sabihin, yung nakikita natin na census mula sa Epi Bureau falls short. So there are still other people currently living with HIV who do not know their status. And ito yung gusto natin sana na hingan ng tulong sa ating mga other service providers kasi they might be already seeing them. Hindi lang nila alam yung kanilang status. So if we provide our doctors out there with the capacity to be able to provide PICT, then mas tataas yung reach natin. Kasi may mga some conditions na of concern sa mga patients natin which they do not attribute to HIV agad-agad. So kunyari nga yung rashes, no? Kunyari rashes. Isipin nila, ay rash lang to, 'di ba? Parang pupunta na ako ng derma. And we want sana na to empower them to do the HIV test already from the get-go. Okay. So let's look at some examples where PICT may be useful. So first, we have AC, a 23-year-old G1P0 who comes in for a prenatal check. She is not yet a member of any key population. So lahat ng previous partners daw niya, all boyfriends, reportedly monogamous. And you tell her that she is at low risk for HIV. So ang goal mo ngayon ay to provide information that she will need to make an informed consent. So anong pwede mong sabihin? Maaari mong mag-provide ng brief summary of HIV basics. You want to present HIV testing as routine and helpful. So what you can do is you can share yung facility data ninyo on how many pregnant participants actually undergo testing. And you want to provide action items, no, for either result positive siya or negative siya. Next slide. So ang maganda dito is sa ating mga antenatal clinics, may policy support na tayo for testing of pregnant women. And the good thing is, ang HIV ay may kasamang iba pang test. So parang nakabalot siya sa prenatal blood package, parang ganyan. No? Kasama ng Hep B, syphilis, rubella, UTI, and pap smear for HPV. The POGS or the Philippine Obstetric and Gynecological Society has released guidelines pa nga to prevent mother-to-child transmission. And voluntary testing of pregnant women are part of this. Ang DOH is also monitoring these antenatal clinics and the elimination of mother-to-child transmission sa kanila is a key performance indicator. And it is said na na-achieve natin to if there are less than 50 new HIV infections per 100,000 births. So, meron tayong monitoring and evaluation. Next slide. Sa kabilang dako, sa mga TB clinics naman natin, isa ng recommendation na all TB patients at least 15 years and older should be offered HIV testing. No? This is recommended in all TB dot centers and all MDR-TB clinics. So hopefully, mangyari din to sa mga private clinics as well na nag-offer ng HIV care. So DOH also monitors the key performance indicators through these values. So inaalam nila ilan ba ang TB patients na may HIV na tinetest, ilan ang PLHIV, screen for TB, etc., etc. Okay? So we like policy support. So next, balikan natin yung pasyente natin. So itong pasyente natin kanina is unaware about HIV. She is scared and asks you what will happen. So ang goal mo ngayon is to manage the potential risks and difficulties by considering the psychosocial, legal, and health implications of her knowing the client status. So ang tanong ngayon sa mga clinicians natin na hindi naman direct HIV service providers, can you cover this all in one consult? Depende, gano'n ba katagal ang sinuspend yung time with the patient? 15 minutes, 30 minutes, 1 hour. You will know when you do it often enough. So share ko lang, na-realize ko na if I want to work with people living with HIV, one thing I should be able to give is time. Kasi yung typical na consult ng mga magulang natin, it takes 10-15 minutes. You cannot do that in HIV because you have to inject counseling, no? Even among patients na matagal mo ng pasyente, kailangan mo kamustahin. Kailangan mo pag-usapan ng mga bagay other than yung concern nilang na nilalapit sa'yo. So, hindi pwedeng, time is kumbaga very important of a thing that you will give. Sample lang for initiation of meds sa akin, first visit or initiation, it's an hour block. So, isang oras, isang tao lang yan. Pero yung mga follow-up na once a year or every 6 months, 30 minutes yan. Pero hindi ko kaya ang 10 minutes. Yun lang. Baka mabagal lang talaga ako. Okay, next slide. So, itong sa gusto natin mangyari sa pasyenteng to, how will we do that? We will need to explain bakit tayo nakaabot sa conclusion na low risk siya for HIV. So, pag-usapan mo siya yung rates of transmission, yung risk niya for that, yung pagkakaroon niya ng monogamous relationships actually bring her low risk also. Pero also assure that HIV testing is being done routinely and it's for the benefit of both her and her child. Assure mo that her results and her testing itself is going to be kept confidential and that you, the doctor, and the facility will take legal responsibility over the information to give her peace of mind. You want to explain the next steps depending on the result. Ano mangyayari kung positive ka? Ito. Kung positive ka sa pagkakataong ito, we will enroll you in care early. We will keep you on medications because adherence to care will result in a baby that can still be born HIV negative. And then, magkakaroon ka ng benefits of early detection for her. Pag negative naman siya, mag-share tayo ng risk reduction strategies. Kung meron tayong mga support system para sa mga nanay living with HIV, share din natin sa kanya na para meron siyang pwedeng pagtanungan kung wala tayo. Next slide. And since nga may policy na tayo para dito, we expect that there should be a process in place na. No? May algorithm na kayong susundin. Example, gagawin mo yung prenatal consult mo, offer mo yung HIV test, obtain the consent, provide mo yung lab request sa kanya, which includes your HIV test, and then i-accept siya ng lab ng facility ninyo, or kung wala man kayong lab na facility, refer mo siya sa treatment hub na malapit sa inyo to do the formal testing and counseling kung hindi mo siya kayang gawin. Okay, so that's our first case. Next po, sige. So we have JJ, a 29-year-old cisgender male presenting with rashes on both palms. So sabi niya, magpaparesetalo ako, Doc, ng steroid cream para sa eczema ko sa kamay. He has already consulted Google and due to his findings, has not been able to sleep for 3 days and is visibly anxious. So ang goal mo ngayon is to assess yung readiness niya to take the test. Okay? So one way to do this is you ask him, anong gagawin mo kung mag-test ka ng negative? Or anong gagawin mo kung mag-test ka ng positive? So again, you want to provide the information na kailangan ni JJ para mag-make siya ng informed consent. But because he is now at higher risk of probably testing positive for HIV test, you would like to nudge him towards taking the test, no? So how do you do this? So one of the few things you can do is you want to explain how easy it is to do a rapid test, how to interpret it, and you want to provide an action plan for him. Siyempre, huwag mo kalimutan yung reason niya for coming in today. Siyempre, ang concern niya yung spots niya sa kamay. Addressin natin yan, of course, no? Tapos, examine him also for other urgent issues and do point-of-care testing. Ito yung sinabi ko na sana meron tayong mga rapid test din sa mga facilities natin para mabigyan natin ng kasagutan agad-agad yung sitwasyon ng mga pasyente natin, no? Okay, next slide. So, kunyari, you do a rapid test, no? And it turns out to be positive. So, remember that the foundation of good post-test counseling is established during the pre-test counseling session. Ang goals mo rito are the following. You want to inform the patient of the results simply and clearly. Give him time to absorb the information before proceeding to the next steps. Kasi marami kang next steps dito. Gusto mo munang bigyan ng time yung pasyente na, okay, ito yung status ko. Explain mo yung next steps. This will give hope and concrete engagement in care. Very important na i-mention mo yung U equals U and how soon this will be achieved. So more on that later. After this, assess mo yung ability ng pasyente mo to cope with the result of the HIV test in the next 48 hours. Kailangan ba niya ng support? Kailangan ba niya ng extra tao na makakausap? Ganon. And if naisip mo na, oops, kailangan niya, please give resources. Kung meron kayong case manager sa clinic, i-assign mo na, bigay mo yung number, and sabihin mo na for any concern, you can contact your case manager directly. Okay? Alamin mo kung ano yung support system niya pag uwi niya ng bahay. Okay? If wala, then we should be able to provide it muna for now. Okay? Give hope, show that you care even if you yourself will not be the doctor. Next slide natin. So, in relation to my last statement na kahit hindi kayo magiging doktor, find a treatment partner, yung treatment hub nyo na pwede mong i-refer sa kanya, na madali mo rin kausapin in cases na gusto mong kamustahin kung pupunta nga sa inyo yung pasyenteng refer ko. So ito yung sinabi ko kanina na don't forget to explain about U equals U. And this is just to share with you some references, no, in case you want to read up more about it. These are the landmark trials which led to that, no? So, ito yung partner study in 2019 which concluded that the risk of HIV transmission through condom-less sex when the HIV viral load is suppressed is effectively zero. So, how to explain it? If you become undetectable and you have unprotected sex, ano po ang risk na mapapasa ko ang infection ko sa aking sexual partner? So, they're asking you for a number and you have to tell them that it's zero. Okay? We're just talking about HIV here, no? So the risk of HIV transmission is zero when you are undetectable. And next slide. This was echoed by the Partner 2 study, which now focused on MSM couples, no? Again, emphasizing that there were no documented cases of HIV transmission within couples. Okay, next slide. Ito nga lang yung catch doon, no? Sobrang dami mong gustong i-share sa pasyente mo. There's too much information you want to share. And no doubt, everything is important. Kailangan niya malaman ito lahat. Pero you can't give this all to the patient in one sitting, no? Pinaprocess pa niya yung diagnosis niya. So, pipiliin mo ngayon. Ano ang kailangan kong i-share sa kanya na kaya niyang i-take ngayon? Because all the rest, you can stagger it in your next consults, or you can provide a list or some IEC material na pwede niyang balikan kapag medyo nahimasmasan na siya. Or kung kung hindi uso ngayon ng mga papel, pwedeng link, no? Lalo na kung tatakot siya na baka makitaan siya ng any literature on HIV. Send him a link to your website on his phone. Or refer mo sa case manager mo. Okay? You can always hand over the counseling part to someone who is more trained, who has the time to do this, no, after your consult with them. Pero i-rundown ko lang ito lang yung mga information na sana ay maibigay niyo sa pasyente. Okay? How to prevent transmission while hindi pa siya undetectable. You wanna provide condoms, lubes, how to guide them for the use. Provide information about other preventative health measures, disclosure, encourage referral for testing of other people within their world. Yan. And if you want to extend counseling service, you want to actively refer them to your counselor. Hindi papel lang. Mas maganda kung ipakilala mo. Diba? Active referral yun. Active handover. Yun. Sige. Next. So, yan yung kapag siya ay positive. Pag negative naman, mag-iiba yung goals mo. Yung goals mo now is to maintain him on a negative status. And how to do this is you have to go over risk reduction measures. Not only will you inform them of what these are, but also where to get them. So, where to get condoms and lubes, where to get PrEP, where to do regular HIV testing. And see if there are other factors sa buhay niya na maaari makakapag-contribute to risk. For example, alcohol or drug use, may mga behavior change ka bang gustong i-apply sa kanya, and then again, determine if kailangan pa niya ng extra counseling support. Okay, next. So, before I go to my last case, 1 second lang. So, ang ating last case, we have Didi, a 32-year-old transgender woman coming in with elevated liver enzymes. So, sabi niya, nagpa-APE ako sa office at nirefer ako sa doktor kasi sa SGPT, SGOT ko mataas. Kaso, nag-liver package test na rin po ako. Ito yung resulta. So, ito yung first consult niya, and you notice na ang taas nga ng SGPT, SGOT niya, tapos yung Hep C niya is reactive. Okay, so yan yung situation nyo. So, ang goals mo dito sa meeting na to is, first, you would like to acknowledge your patient's SOGI, no? Ito yung sexual orientation, gender identity, and expression niya. So, you will ask for your patient's preferred name and pronoun. You want to document them, use them, and then also inform your staff, no? Para lahat kayo ay aligned. And then you will prioritize your patient's problem. So, may Hep C siya. And background music. Wala po akong background music, ma'am. May background music ba ako? You would like to test for other STDs, including HIV. So, next. Oh, so gumawa ka ng rapid test, no? Thankfully, meron kang mga HIV tests sa iyong clinic. She tells you, she is positive, okay? And then further prodding reveals that she does sex work as her second means of income and gets paid more for unprotected sex and when there are chems involved. So chems are drugs that are used to increase the pleasure of sex, such as injected methamphetamine, GHB, ecstasy, and poppers. She also does her own hormone replacement therapy with oral estradiol and plans to continue it. So sa sitwasyon na to, ang goals mo ay to acknowledge your patient's desires. So desire niya is to continue her HRT, and also to continue sex work until hindi pa siya financially stable. So you have to acknowledge that, no? Reality niya yun. You will now prioritize yung health concerns ng patient niyo and know where she is in the stage of behavior change. And because she is a member of the KP community na maaring high ang loss of follow-up rate, you want to keep her engaged in care. Okay. So, next slide. Next slide po. Yan. Ito naman yung sinasabi ko kanina na stages of care. Okay. So, you might be familiar with this, no? Ito yung iisipin mo, anong stage yung pasyente ko? Kasi you want to be able to provide options based on that. So, based sa kwento ng ating pasyente, maaaring siya ay nasa contemplation stage, no? Ang contemplation stage is when she acknowledges that there is a problem, but she's not ready nor confident to make a change. Okay, so anong gagawin natin after this? Next po. So what we can do is we can practice accurate empathy. So accurate empathy is us taking an active interest in an effort to understand our client's internal perspective, reflected by genuine curiosity and reflective listening. So we can use motivational tools. For example, ito yon for motivational interviewing. And ang importante, ang conversation na to should be collaborative, no? Hindi ito one-sided nor prescriptive. Minsan as healthcare providers, nagiging one-way ang conversation kasi sanay tayong bigay ng advice eh. However, in motivational interviewing, collaborative siya, two-way. It should be evocative. You want to get more information and input from your client, and of course, should honor your patient's autonomy or meron tayong respect sa kanyang katawan and pagdidesisyon niya para sa sarili niya kapakanan. Okay? Next po. Wait lang lilipat lang po ako ng lugar. 1 second.
Sir Richard, we will call you po later after the presentation of Doc Kate po. Thank you.
Okay, sorry. Lumipat lang ako para mas tahimik. Okay, thank you. Can you hear me, Alan?
Yes, Doc.
Okay, great. Sige. So, on your next visit sa pasyente, nag-ART na siya, nag-Hep C meds na rin siya. So, you continue your counseling and you now want to discuss risk and harm reduction during her sex work. So, gusto mo nang mag-focus ngayon sa counseling niya. So, this is how you wanna do it, no? So, you wanna engage. So, in engagement, we will build rapport, we will find out how we can help. So, what we do is, we need to ask about the sex work. But, we must avoid writing or fixing. So, ito yung tendency natin na i-correct yung mga nakikita natin na maaring weakness niya or pagkakamali. So, because we want to engage, magtanong muna tayo. And we will avoid the reflex to right the wrongs. Second, we have to focus, no? Target an area wherein they are struggling to make a change. And in this situation, maaari ito yung ang paggamit ng condom during sex work. Sorry, Alan, may nagsasabi na may maingay yung background. Tahimik naman sa part ko.
Okay lang ho sa part ko rin po, Doc.
Even on my end, clear ka. Walang noise.
Sorry. Okay. Hold on. Ma'am Annie, baka sa inyo po yung background, hindi po sa amin. Sorry po. Kasi mini-mention lagi niya eh. Okay. back to it. Okay, sa tayo. Okay, so kunyari, gusto mo i-target yung paggamit ng condom during sex work kasi ang goal mo is to move the behavior from no condom, kasi mas yun ang gusto ng kliyente, to baka pwedeng mag-condom. So, how do we do it? Tanungin natin. Tanungin mo siya, sino ang nagde-decide na walang condom ang gagamitin? May choice ka ba in the matter? So, you wanna listen. Baka naman meron siyang masabi na helpful information. And this leads us to the third step, which is evoke, no? We want to draw out the intrinsic motivation from her and get their own possible solutions for the change. Kasi syempre, mundo niya yun eh. Ikaw, nakikinig ka lang, no, bilang healthcare provider. So, isipin mo, baka may alam siya na ang gulo na pwede niyang ipasok na sa kanya magaling yung desisyon ng paggamit ng condom. So, let's ask, no? When you insist, no, isang sitwasyon na binring up mo yung condom at nag-succeed ka, anong pakiramdam mo nun? And if you do it, more often than not, how will it change the things for you? Lilit ba yung sweldo mo? Talaga? O malamang ikaw yung irerespeto ng kliyente mo. So we want to know, no, sa kanya manggagaling yung solusyon. And we must avoid feeling like the expert here and dictating what we think should be done. And then if we find a good idea, a good change idea that came from our client, let's pursue it. I-follow up natin. So pwede mo sabihin sa kanya, so kung sa sitwasyon na to nag-succeed ka, in the next instances, paano mo sisimulan yung usapan na sana mapunta tayo sa dapat may condom sa kliyente? Kumbaga, let's build up on the plan na sinimulan niya. So that's how we, an example of MI can be done. So ang remember lang natin na behavior change is a cycle, no? And you can move from contemplation back to zero, which is pre-contemplation. Yung pre-contemplation stage is there's no problem, walang issue. Pwede kang bumalik doon. Or kung lucky ka, you can move from contemplation to action. So sa mga instances na nagpa-falter tayo or parang, my gosh, umikot na naman tayo, bumalik tayo sa zero, please don't get frustrated, no? Please think that, remember that behavior change is a cycle. It's a never-ending cycle, and sometimes even if you're already successful, you can relapse and go back, no? Kapit lang tayo, sundan natin yung pasyente kung nasa ang stage sila, and support lang pa natin, no? This is not your failure. This is really us giving support where it is needed. Okay? Next slide. So there are other MI techniques that you can use. So an example is open question, affirming, reflective listening, summarizing. Tips lang to or techniques. Ang code namin dito is ORS. You might be practicing this already, hindi mo lang alam, no? But it's nice to learn about it so that you can affirm na, oy, effective. Effective yung affirming. So, yung tatag dito is active listening, no? So, hindi lang tunganga ka lang, no? There are some cues that you show the patient na you are hearing them out, no? Ito yung affirming, simple nodding, yes, reflective listening, ibabalik mo sa kanya, summarizing at the end of the topic. So ito yung naintindihan ko sa iyo. Ito yung problema mo, blah, 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 blah. So parang, kung ikaw, magkonsulta ka sa kaibigan mo, gusto mo malaman na nakikinig ba talaga sa akin to. So ito yung mga ways how to do that. And these are the other tips, no? Rule naman, no? Resist the writing reflex, understand the client's own motivations, listen with empathy, and empower the clients. Next. So, ang motivational interviewing has been shown to improve adherence. Next. Improve sexual risk behaviors. Next. And decrease the incidence of drug use among people living with HIV. So helpful siya, no? So feeling ko when we move towards universal healthcare, ang mga providers, konti na lang ang kailangan nilang matutunan to engage in provider-initiated counseling and testing. Yung basics alam na nila. Itong siguro additional skills na lang, no? Additional skills in motivational interviewing para mas meron silang technique on how to guarantee someone to engage in HIV testing, techniques to help us decrease our loss to follow-up rate, techniques to help keep the patients in care year after year after year. Kasi at the end of it all, makakatulong sa atin to. Okay? Next po. Ngayon, syempre, may mga pasyenteng resistant to change, no? So, this is another session of motivational interviewing and wala tayong time to discuss this. But I think, no, it's something that we should invest in, no? So, calling yung mga CHDs natin, magpa-workshop tayo ng motivational interviewing sa mga care providers natin para dumami pa ang ating mga kalaguyo. Next. So, other tips. Next. Yan. So, the patient has the right to decline the HIV test and testing and the testing will be performed unless okay. So it is a decision of the patient to do an HIV test. Declining an HIV test will not affect the patient's rights to access other services. So kunyari, ayoko magpa-HIV test pero gusto kong humingi ng condom. Pwede, bigyan mo pa rin siya ng condom. Okay? Hindi naman nakadepende sa knowledge ng status ng pasyente ang kanyang ability to get tools for prevention. In the event of an HIV positive test result, encouragement of disclosure to other people should be given, no? So, yung skill mo sa pag-encourage for disclosure is really important. And sometimes, kung hindi kaya ng pasyente mag-disclose, you can actually help them, no? Ikaw yung magiging bridge disclosure. So it's a service that you can actually offer. And of course, provide opportunities to ask questions. So before you end the thing, sabihin mo, may mga tanong ka ba para sa akin? So don't end without asking that. Next. So ito yung mga expected from, although hindi tayo counselors, ito sana yung maganda, no? Ng establishing rapport, privacy and confidentiality, showing respect, acknowledging different feelings, showing empathy, and offering acceptance. Next. Yan. So, ito lang yung repeat nung kanina. Yung mga techniques on communication tips. And last ko na. So, ito. Bakit ko ba pinupush tong PICT? So, health facilities represent a key point of contact with people with HIV who are in need of prevention, treatment, care, and support. So there's overwhelming evidence that there are opportunities to diagnose and counsel patients in facilities which do not provide direct HIV care. And so kailangan natin ng provider-initiated diagnosis para ma-bring silang lahat towards HIV care. And I think that's it for my last slide. Hoping that if we all practice PICT, itong 63% natin is going to be much closer to 95%. So, thank you for listening and good morning.